Okay, so it'll come out. The sterile tech always wants to make sure that the BD logo is facing up. Okay, sometimes during transportation, this will have a bunch of plastic in the way. Okay, so the sterile tech or Dr. Williams will go in and manipulate the bag just to make sure that there's a clear pathway. And to show you here.
Oh, okay, for the drill.
Yeah, for the drill. So we don't obviously want to try to just put the drill in over the plastic. It'll tear up the plastic, and we just want a clear pathway. There's a notch right here. See this notch that my finger fits through?
Mm-hmm.
Okay, finger fits through that.
It's this down here. Okay,
Yep.
gotcha.
This drill has to go, this piece has to line up perfectly
With that notch.
with the notch. Okay? Just like that. So when I'm putting it on, the easiest way, clear out the bag. The non-sterile rep will go in here, place it, and it's easiest to do it vertical to you. And you want to hear it and you want to feel it.
So your circulator will do that part.
Yep. So you're gonna place it in, you're gonna hear it, and you're gonna feel it. Then the sterile tech will go underneath the bag. We are getting rid of the zipper, so don't even worry about it. But if you want to zip it, because the stock you have now is what it is. And then you'll take off the strip.
So it won't have a zipper at some point.
At some point, yeah. It's just that, or we're gonna fix the zipper. We didn't get the memo of how Ziploc does their bags, I guess.
Oh.
I mean, it works. This was the second like safety feature, anyways. So we're just gonna use the adhesion. So take it. You're gonna lock it over, and then give it a nice touch on the drill. And then pull it, make sure that it's not like wiggly and that it's on there good, and then they're good to go. Okay, so that's the biggest thing for you guys, is making sure there's a clear path. Setting the driver vertically in is the best way, and then giving it a nice tap on the trigger and making sure that it's not going to come off.
Okay.
For the actual needles themselves, this is the marrow needle. It's going to come in there like this. This is the needle grip, so this is nice for the doctor to be able to hold on to instead of getting his gloves caught up. He can hold it and go down. So therefore, you don't want it to be up top. You want it to kind of be down. So go ahead and unloosen that for them. Same technique. He'll take out the stylet. He'll go in, get the quick sample. And then this is where you guys, will give him this. This is the ejector guide. Because this has on this marrow, it has a ridge right here. It's going to keep the marrow inside the needle so it won't fall into the body. So you're going to use the ejector guide and the ejector rod, and you're going to do it distally. And the easiest way I do it, I'm like, put it on the sterile and he can just tap it to kind of loosen up the marrow. And then I always like to put it in something sterile like this, or so it doesn't pop out or fly away. So that's how the marrow works. Okay?
And then you can just put it in a sterile cup.
Yeah, and I mean, if a lot of the time the marrow is going to be soft, and he's not going to need to do that, so he'll do it the same way. But this, I guess, more is for the lesion, like the harder bone, where they're really having to use the muscle to get out the sample. Now, when they're all done, you guys, to take this off, okay, you want to push and pull. Okay, so push and pull. You don't. This. You want to push, put your finger here, and pull straight back.
Okay.
And in that situation, that's fine if that happens when you're done with the procedure. But you're going to push and pull. What you don't want is you don't want to like wiggle it, right? And try to wiggle it to come off or do that. You want to push and pull. Otherwise, this axle, you constantly wiggle it off, could end up damaging this piece of it. So I'll actually let you kind of get a feel for it. And I know it sounds stupid, but putting your elbow straight out like that, pushing it.
And then it goes in, you said the notch lines up.
Yep.
And then in between cases or after procedures, she said you can wipe down the
Purple Sani wipe.
handpiece with like a Sani cloth.
Yep.
Don't immerse it.
Correct. Don't
Okay,
immerse it.
sure. So is the the battery need changed every so often? or-
No,
it's
it's
done. It's done.
gonna get you through about 150. I mean, with Marrow, probably closer to 200 procedures, which is nice. This has a 90% sustainability, meaning that you will not ever lose power on the drill till the 10%. So, if you do me a favor while you're recording this, push the trigger for me. So there's this light. It's a battery indicator. Okay, so it also shows you like how gently you're pushing the trigger. So lightly, light green, bright green for full speed, full force. This green light will turn to an amber red when there's 10% left on the battery. So I would say you can get through at least, if you see it red, get through one case and then I'd toss it, or at least have the other drill as a backup so you're not opening up another drill and everything in the meantime.
And we have 3 here.
Yeah. One of them's still downstairs for right now.
Yeah,
Well, is he gonna use it for every bone marrow or just select patients?
I would
I
say
think
every.
that the plan is for, once we get the other ones that we have on the shelf, which I think we have 7 right now, once we've used up that product, then I
We
think the
have
plan
2
is to
sizes.
use that for every single one.
Yeah, we have 2 different sizes that we need to use.
Yep.
So.
And so this one, the Marrow comes in 11 gauge, 10 and 15 centimeters, and you guys have both lengths. So just ask, the doctor depending on the patient size. And then our Lesion, if you guys do end up ordering those, we do have 6, 10, and 15 centimeter, 10 and 11 gauge. So
Should I be good to stop?
yeah.
Okay.